fourth semester nursing student at Lincoln. It is March 28th and 2:20 p.m. and I'm doing a female catheterization demonstration. So, hi Mrs. Smith, my name's Elizabeth and I'm going to be your nursing student today. The doctor has put in an order for us to do your urinary catheter because you haven't voided in a while. Before we start that though, can you confirm your first and last name and your date of birth? Good. Alright, can you tell me, do you have any allergies to anything? No, that's perfect. Alright, when was the last time you voided? Alright, so it's been long enough that there's abdominal distension and discomfort. So as the doctor ordered, we're going to go ahead and do the catheter. Alright, Mrs. Smith, I'm going to raise your bed up pretty high and lower your head. Let me know if you feel any discomfort though. Alright, we're going to raise the bed to working level above my waist so we maintain sterility. For the first part, I'm just going to don on non-sterile clean gloves to do peri-care. And as stated, the patient stated she had no allergies, so we don't have to worry about that. Alright, Ms. Smith, I'm going to go ahead and expose you.
Go.
I've also gone ahead and provided privacy, as well as additional privacy with the back blanket. I'm going to raise your legs up to a frog leg position and drape that blanket over you for more privacy. I'm going to start by performing the peri-care. For the in practice, you would use about 3 wipes, but for this demonstration, we're only going to use 1. So I'm going to start with farthest away from me, dispose of it, closest to me, dispose of it, and then down the urinary meatus, and dispose of it. At this point, her peri-care is done, so I'm going to clean off my working space and don off my clean gloves, or my now dirty gloves. I'm going to go ahead and move that blanket down a little more. For the purpose of this, I'm going to set up my sterile field in the bed. I'm going to perform hand hygiene and make sure the legs are farther apart so I have a good access. I've now cleaned off my working space and I perform my hand hygiene. I'm going to check my bag to make sure it's not out of date and to make sure that there's no water stains or breaks in the sterile field. I'm going to place my sterile field right there. Miss Smith, I'm going to ask that you stay still, okay? Alright. My sterile gloves are in there. I'm going to carefully pick them up and go ahead and do my sterile gloving. I've already done my hand hygiene, so I am ready to go. Once again, my sterile gloves are also to date, and they don't have any water stains. I'm going to start with my dominant hand. I still have that inch of border. Since my dominant hand is my right hand, we'll start there. I will now don on sterile gloves. Watching that thumb, I'm going to go ahead and don on my left sterile glove. Alright, I'm now going to keep my hands above my waist to begin the sterile procedure. I'm going to start by taking a drape and opening it above my sterile field. The shiny side will go down. Alright, Mrs. Smith, can I have you lift your butt up for me? Thank you. Alright. I will then begin to set up my field. I have my swab sticks. For the demonstration, we're just using saline swab sticks, but in practice, we would use iodine. Iodine just stains the mannequins. And making sure not to cross over my field, I will then dispose. At this point, I will use my lubricating gel, Once again, making sure not to go over my sterile field and keeping my hands above my waist. I will then start by prepping my catheter. For the female, you will only lubricate 2 inches. And since this is sterile, I'm still okay to touch it. So I have 2 inches of my catheter put in the lube. And now I'm ready to break my sterility with my non-dominant hand to perform the sterile technique of cleaning her. So I'm going to go ahead and begin by cleaning her, grabbing my first stick to do my outer, disposing of it, my next stick to do her inner, disposing of it, and my last stick will go down her urinary meatus and disposing of it. At this point, I will then begin to insert the catheter. Upon policy, if I needed to pre-inflate the balloon, I would, but for this demonstration, we do not have to. I'm then going to insert 2 to 3 inches, or until I see a flash of urine. Alright, I now see urine, so I'm going to go forward another inch and grab an inch away. At this point, I will now inflate my balloon. This said for 5 mils, and since this is 10, I'll just watch to make sure I only go 5. Alright, and at that point, I will then dispose of this away from my sterile field and pull on it. There is no resistance, and she didn't feel any pain or pressure while I was inflating the balloon. At this point, my sterile technique is finished, so I will place this against her leg and hook this to a non-movable part of the bed. I will go ahead and doff off my sterile gloves and perform hand hygiene. I will then don on non-sterile clean gloves to clean up both my patient and my patient's bed. I will now clean up my patient because she will have iodine on her, and that's not usually comfortable. So I'll just do a normal care. Once again, you would usually use 3, but for this demonstration, we will only use 1. And just cleaner, dispose, cleaner, dispose, and then clean down the middle, hold on to the catheter, and clean down. At this point, I will dispose of everything. And I will chart that I used a 12 fringe catheter, how she handled it, how much saline I put in, as well as what the characteristics of that first urine was. If they asked for a urine specimen, I would have collected that at the very beginning while it was going into the bag. I will then cover her back up, lower her bed down, and make sure her call light is near her. Once again, I'll chart how she handled it, as well as the characteristics regarding the Foley. So at this point, it's been about 3 days, and I have a doctor's order to remove that catheter. So once again, I'm going to knock and, "Hi, Mrs. Smith. The doctor has decided that we're going to go ahead and take your catheter out. Can you tell me your name and date of birth?" Good. And can you tell me, are you feeling any discomfort or anything at the moment? No? Good. Alright, so at this point, I will have her at a working level. I'll have performed hand hygiene. And this is just a clean, not a sterile procedure. so I will not need sterile gloves at this point. I've got a bath blanket for privacy, as well as a towel, because usually once you remove the catheter, there's urine that spills out. I will then don on clean gloves. Miss Smith is going to use a bedside commode, so I have that next to her for whenever she does have to pee. Alright, Mrs. Smith. I've provided privacy. I'm going to roll down her sheet and pull up her gown, as well as put her legs in the frog leg position. I have checked the chart and I only put 5 mils in there, and that 5 mils, let's keep it going because I'm going to edit this part out. Okay. There was 5 mils, so I went ahead and grabbed a 5 mil syringe. I'm going to go ahead and attach that to there. And put a towel underneath to catch that urine, as well as a bath blanket on top. So I will remove and make sure I remove 5 mils of water. At this point, I will go ahead and remove the catheter, wrap it up, and dispose of it per the policy. I went ahead and emptied the bag as well, which will go into my charting. I will go ahead and perform peri care on her. Once again, you would usually use 3, but for this purpose, we're only going to use 1. I'll clean the outside, dispose of it, the inside, dispose of it, and down the middle. Now, Mrs. Smith, the first couple times that you go to the bathroom, you might feel some burning, but that's normal. I'll chart the color and how much urine was in her bag. I'll also chart how she handled me taking that catheter out. And I will keep an eye out for her having her first void. I should expect it within 4 hours. But if not within 4 hours, I would expect to want to bladder scan her to make sure she's not retaining any more urine. At this point, I will make sure she's comfortable and has her call light in reach. Miss Smith, you let me know when you have to go to the bathroom. Her head is raised. Her bed is lowered. And I will perform hand hygiene. And that's the end.